Our top story, Queensland health authorities have linked the state's latest locally acquired COVID case to a previous cluster, but still don't know the exact transmission chain. A 26-year-old Brisbane man tested positive to coronavirus on Thursday, and his case has now been linked to the cluster at Princess Alexandra Hospital earlier this month.
This case has sent aged care facilities, disability accommodation services, correctional facilities and hospitals back into lockdown, while the other states and territories have been quick to impose restrictions on travellers from the area. Well, for more, we are now joined by reporter Rachel Riga, who is in Brisbane for us. So, Rachel, do we know who this man contracted the virus from?
Not yet. So what we heard last night is that genomic sequencing has found that the man is linked to the previous cluster that we saw about 2 weeks ago that involved a doctor from the Princess Alexandra Hospital who contracted coronavirus from returned overseas travellers who were staying at the Grand Chancellor Hotel, which is a quarantine hotel here in Brisbane. So that testing also found that he has the highly contagious UK strain of the virus. So health authorities say they will know more today, but they're trying to work out exactly how he contracted the virus. They say it's likely that there was another unknown person who has transmitted the virus to him. So currently health authorities are contact tracing anyone linked to the man and anyone who was possibly at these number of venues. So what we do know is that the man has been infectious in the community since last Friday. He went to a number of venues across the Brisbane and Moreton Bay region. He travelled to a number of locations on Saturday, Sunday and Monday, and then he started feeling unwell. So he stayed home for a few days and then got tested on Thursday and returned that positive result.
Rachel, you mentioned there Brisbane and Moreton Bay. So who in those areas should get tested?
So there is that contact tracing public health alert that is current for a number of venues. They've identified the most high risk at the moment is Mama's Italian restaurant. That's at Redcliffe. So anyone who was there on March 21st, which was last Sunday, from 12:30 to about 3 o'clock, they're being considered a close contact and you're urged to go home and quarantine at home for 14 days and get tested. And no matter what your results are, you have to stay at home quarantine for those 2-week period. So then we also have a number of casual contacts. So that involves about 8 locations and you're urged to get tested and isolate until you receive a negative result. So again, if you need to check those locations, they are all on the Queensland Health website. And then we've got 2 locations that have been deemed low risk. So that's where this community transmission case has gone to Aldi, say, at Stafford for 10 minutes. So again, you're being asked to monitor your symptoms. But there is the advice out there that anyone in the Brisbane and Moreton Bay region, if you are feeling unwell, please go get tested.
And Rachel, states have reacted quite quickly and some have put restrictions on Queensland travellers.
Yeah, absolutely. We've seen a number of states react quite quickly. I can take you through a few of them. We've seen Victoria, they have that traffic light system for their restrictions. So the Brisbane and Moreton Bay regions are now declared an orange zone. So that means anyone travelling to Melbourne from Brisbane and the Moreton Bay region will need to apply for a permit. In New South Wales, anyone who is a close contact, so that's deemed in that high risk area like Mama's Italian restaurant, cannot enter New South Wales, but people who are already in New South Wales who may have been in those zones, you're being asked to get tested and isolate for 14 days. And if you are at any of those other venues as well, you should get tested. And then Tasmania, they're currently contact tracing anyone who may have been at those locations as well. Again, you're being asked to get tested and self-isolate immediately. And we've also seen some restrictions from WA, just asking anyone who was at those high-risk locations, again, get tested and isolate. So a few different levels of warnings for different places that we've seen this morning, but we are expecting the Premier and the Chief Health Officer to give us more of an update this morning.
All right, Rachel Riga there reporting for us in Brisbane. Thank you.